Dear learners, welcome to the teleconference session. Today we will be discussing for Certificate in Community Health Program students theory course. We have BNS 41, BNS 42 and BNSL 43. So today's topic is being taken from BNSL 043 Block 1 Unit 7, and the Unit 7 deals with the report writing and IT skills. Dear learners, this topic we have chosen today because you are going to, whether you conduct any procedure or you are learning anything, you have to report as well as you have to record everything. Unless you do the proper recording of activities carried out by you, it will not solve the problem. It will going to not give you any credit unless it is being recorded. So the session today will be dealt in two parts. So to discuss this topic, we have with us Dr. Nidhi Bhatnagar from Maulana Azad Medical College. Madam is Associate Professor there in Community Medicine Department. And myself, Dr. Rita, I am Program Coordinator also. So as you know, the objective of report writing is that you should be able to carry out the work properly and record it properly, and how it has to be carried out, including manual recording as well as on the digital mode. So we will be covering the two of the things in this session today. For that, you need to have availability of the registers, required registers. What all registers you have to maintain in the field, you should have all that, as well as you should also have the equipments and the drugs available to you so that you can give quality care to the patients in the sub-center level or in the health and wellness centers. And you should be able to fill these records properly, what all points you have to keep in mind while filling the records, and whether you do it manually or through the digital mode. So we will be discussing all these aspects in this session. So to start with, let us see what is there in the register, records and the reports. I would like Dr. Nidhi to first tell about what is register, a record and the reports.
So whenever we are working for the healthcare system, we have a set of documents that we deal with. It can be in the form of registers, it can be in the form of records which we store in our health system, or something which we compile from this and we send it to higher authorities or to our field staff, which can be mentioned as reports. So जो हमारा सारा health data है वो register, record या report के माध्यम में हमारे center में रहता है और हम उससे उसका आदान प्रदान करते हैं. तो जब हम इससे आगे जाएं तो हम इस बारे में क्लैरिटी ले लें कि ये डेटा इंफॉर्मेशन ये क्या है. क्या जब हम इन वर्ड्स को यूज़ करते हैं, डेटा इज़ एनी पीस ऑफ नंबर. अगर हम किसी न्यूमेरिक डेटा की बात करते हैं, वो नंबर हो सकता है, कोई वर्ड हो सकता है, उसको हम डेटा कहते हैं. डेटा जब एक सिंगल क्वांटिटी है उसको हम डेटा कहते हैं. जब हमारे पास बहुत ज़्यादा इंफॉर्मेशन है, वो एक प्लूरल में उसको डेटम कहा जाता है. उस डेटा को जब हम सिंथेसाइज करते हैं, एक ग्रुप बनाते हैं, टेबल्स में डालते हैं, असेंडिंग या डिसेंडिंग ऑर्डर में अरेंज करते हैं, सिस्टमैटिकली अरेंज करते हैं, तो वो डेटा इंफॉर्मेशन का रूप धारण करता है. उससे हम हमारे सामने एक इंफॉर्मेशन निकल के आती है. और वही इंफॉर्मेशन हम अपना बैकग्राउंड नॉलेज, जो आपकी ट्रेनिंग है, जो आपकी CHO की ट्रेनिंग चल रही है, उस ट्रेनिंग के माध्यम से जो आपकी इंफॉर्मेशन आपको मिली है, जो आपके विलेज मैप्स के थ्रू, जो आपके बाकी जो आपके कर्मचारी आपके साथ काम कर रहे हैं, वो आपको जो ज्ञान देते हैं, उन सबको सम्मिलित करके वो डेटा और वो इन्फॉर्मेशन आपके लिए एक नॉलेज बनती है, आपके लिए ज्ञान का रूप बनता है. और उसको फिर आप अप्लाई करते हैं या आप अपने सीनियर पॉलिसी मेकर्स को इन्फॉर्मेशन देते हैं उसको अप्लाई करने के लिए, जिसको हम नॉलेज और विजडम का नाम देते हैं. तो ये डेटा हमें, हमारा CHO को, हमारा ये मकसद है कि हम डेटा जनरेट कर रहे हैं, जो हम डेटा जो है हमारे पास, उसको हम डेटा से लेके विजडम तक ले जाएं, और विजडम का मतलब है हम उस डेटा को एक्चुअली अप्लाई करें, उसको यूज़ करें.
Yes. So I will add to it like registers, records, and reports. Madam has clearly described what are the registers you need to. We will discuss what all registers we will have to maintain while working. But the information which you are generating is from the grassroots level, because until unless it is the people centric or the need of the people is being taken care, and you have identified properly or adequately the needs of the grassroots level people, and that information is through knowledge, you are on knowledge, and you have given the systematic analysis of that data, that how many newborn children are there in that village, or how many children are being vaccinated. All this information, when through various stages undergo, and this information from your end goes to the wisdom level, that means policy maker level, and there they decide that what all need to be done in that particular village. So as if you will give the right information and you identify the right problem, then only the policy maker will be able to give guidelines that this particular village need this particular facilities, health facilities, so that people get the benefit out of it. So you can carry further.
So now we'll be discussing on some nomenclatures, like what is primary data and what is secondary data, what is variable and what is indicator. What is primary data? प्राइमरी डेटा का मतलब है कि डेटा जिस वजह से कलेक्ट हुआ, डेटा उसी के लिए यूज़ हो रहा है. द डेटा इज़ बीइंग यूज्ड फॉर द पर्पस फॉर विच इट वाज कलेक्टेड. अगर आप हेल्थ इंफॉर्मेशन सिस्टम में आपकी आशा फील्ड जाके डेटा कलेक्ट कर रही है और वो डेटा आप फॉर्म में भर के ऊपर भेज रहे हैं, सब सेंटर से आप प्राइमरी हेल्थ सेंटर में भेज रहे हैं, तो वो आपका प्राइमरी यूसेज ऑफ डेटा हो गया. सेकेंडरी डेटा का मतलब ये है कि वो डेटा जिस वजह से कलेक्ट हुआ है पर वो किसी और वजह से यूज़ हो रहा है. अगर आपके पास कोई PhD रिसर्चर आके आपसे वो डेटा मांगे कि मेरे को मैटरनल एंड चाइल्ड हेल्थ में रिसर्च करना है और मेरे को डेटा की ज़रूरत है, देन दैट बिकम्स द सेकेंडरी यूसेज ऑफ डेटा. तो ये हमारा मतलब होता है जब हम कहते हैं प्राइमरी डेटा और सेकेंडरी डेटा. हेल्थ इंफॉर्मेशन सिस्टम जो डेटा जनरेट करता है, मोस्टली वो आपका ग्रास रूट लेवल का प्राइमरी लेवल डेटा होता है. अब जब हम हेल्थ इंफॉर्मेशन सिस्टम की बात करते हैं, हम दो वर्ड्स बहुत कॉमनली यूज़ करते हैं, वेरिएबल और इंडिकेटर. वेरिएबल का मतलब है वो डेटा जो वेरीज फ्रॉम वन पर्सन टू अनदर. फॉर एग्जांपल एज, वेट, हीमोग्लोबिन लेवल, डेट ऑफ बर्थ ऑफ चाइल्ड. ये वो ऐसे डेटा है जो आपका एक से दूसरे सब्जेक्ट में वेरी कर रहा है. ज़रूरी नहीं है हर डेटा वेरिएबल हो. अगर बहुत से लोग एक ही जगह पे रह रहे हैं, एक ही ज्योग्राफी में रह रहे हैं, तो उनका एड्रेस सेम होगा, उनका ज्योग्राफिकल डोमेन सेम होगा. देन इन दैट केस दैट पर्टिकुलर डेटा इज़ नॉट अ वेरिएबल. Last but not the least, about indicator. What is indicator? Indicator is a variable which measures health in a population. मोस्ट कॉमन इंडिकेटर आपने ये सुना होगा, इन्फेंट मोर्टेलिटी रेट. तो ये वो इंडिकेटर्स होते हैं जो आपके एक पॉपुलेशन की हेल्थ को मेजर करके आपको बताते हैं विथ स्लाइट डिग्री ऑफ इनएक्यूरेसी. और इंडिकेटर्स बहुत टाइप के होते हैं. आपके मॉर्बिडिटी इंडिकेटर्स हो सकते हैं, लोग कितना बीमार पड़ रहे हैं. मोर्टेलिटी इंडिकेटर्स होते हैं, कितनी डेथ हो सकता है. बर्थ के इंडिकेटर्स हो सकते हैं. और ये सारे इंडिकेटर्स एक स्टैंडर्ड सेट ऑफ इंडिकेटर्स होते हैं. और हमारे लिए जो सबसे इम्पॉर्टेंट है वो है कम्युनिटी हेल्थ असेसमेंट इंडिकेटर्स. इनकी क्या क्वालिटीज़ हैं? नंबर 1, दे शुड बी मेथोडोलॉजिकली साउंड. इसका मतलब है वो एकदम एक्यूरेट होने चाहिए. मैंने आपको बताया इंडिकेटर वो होता है जो पॉपुलेशन में एक हेल्थ को मेजर करता है. इट शुड बी वैलिड. जो मेजर करना है वो मेजर करे. अगर हम इन्फेंट मोर्टेलिटी रेट की बात कर रहे हैं, 1 साल से छोटे बच्चे जो मर रहे हैं, तो एग्जैक्टली वो वही मेजरमेंट दे. रिलायबल, हम उस पर रिलाई कर पाएँ, बार बार अगर हम मेजर करें वो एग्जैक्टली वही डेटा हमारे सामने लाए. एंड कलेक्टेड ओवर टाइम, बहुत लंबे समय तक हम उस इंडिकेटर का हेल्प लेके हम यूज़ कर पाएँ. इट शुड बी फीजिबल होना चाहिए, अवेलेबल और कलेक्टेबल. मीनिंगफुल, इट शुड बी रेलेवेंट एक्शनेबल एंड आइडियली लिंक्ड टू एविडेंस बेस्ड इंटरवेंशंस। जो हमारे बहुत बड़े बड़े सरकारी प्रोग्राम्स चल रहे हैं, RCH प्रोग्राम है, नेशनल वेक्टर बॉर्न डिजीज़ कंट्रोल प्रोग्राम है, ट्यूबरक्लोसिस एलिमिनेशन प्रोग्राम है, इन प्रोग्राम के तहत हमारे कुछ आइडेंटिफाइबल इंडिकेटर्स हैं। तो इनका इंडिकेटर्स जो हैं ये उन टारगेट्स को, उन पॉलिसीज़ की जो हमारे माइलस्टोन्स हैं उनको अचीव करने में हमारी हेल्प करनी चाहिए। और इम्पॉर्टेंट लिंक्ड टू सिग्निफिकेंट डिजीज बर्डन और डिस्पैरिटी इन द टारगेट कम्युनिटी। जैसे नेशनल वेक्टर बॉर्न डिजीज़ कंट्रोल प्रोग्राम में बहुत से इंडिकेटर्स हैं जो मलेरिया, डेंगू, चिकनगुनिया, काला आज़ार इनके बारे में बात करते हैं। तो ये सारे इंडिकेटर्स हमारे जो हैं ये बहुत इम्पॉर्टेंट है हमारे लिए नेशनल लेवल पे और ग्लोबल लेवल पे। अब हम एक बहुत इम्पॉर्टेंट चीज़ की बात करेंगे जो है विलेज मैप्स। आप एक सब सेंटर के अंदर 5,000 का पॉपुलेशन रहता है, अंदाजे से हम कहते हैं एक विलेज में आपकी अराउंड 1,000 का पॉपुलेशन है। 1,000 का पॉपुलेशन का 1,000 हाउस होल्ड्स का पॉपुलेशन है, और इसमें आपका 5 to 6 विलेजेस आपके एक सब सेंटर के अंडर आ रही हैं। तो जब आप एक सब सेंटर में हैं, आपके पास इतना बड़ा जियोग्राफिकल एरिया है, आपको ये देखना है कि इस एरिया का कैसा हमारा जो है इसका क्या मैप है, और ये सब सेंटर लेवल पे CHO के पास इसका अंदाज़ा होना बहुत ज़रूरी है। So village maps to identify villages to be covered by SEP center, and you can take the help of आंगनवाड़ी वर्कर, trained birth assistants, महिला समिति members जो वहाँ पे रहती हैं, जिनको उस टेरेन के बारे में बहुत पूरी जानकारी है, उनके मदद के द्वारा आप उस एरिया का मैप बनवा सकते हैं। और उस मैप में आप बहुत इम्पॉर्टेंट कम्युनिटी रिसोर्सेज भी डलवा सकते हैं। जैसे कहाँ आप मीटिंग्स कर सकते हैं, कोई इम्पॉर्टेंट पब्लिक प्लेस, कोई इम्पॉर्टेंट प्राइवेट सेटिंग अगर है वहाँ पे, ट्रांसपोर्ट फैसिलिटीज़ अगर रेफरल के लिए चाहिए, कोई NGO अगर है वहाँ पे, कोई बहुत बड़ा रिलीजियस सेंटर है, कोई सत्संग घर है, आप इन इम्पॉर्टेंट प्लेसेस को, ये भी आपके कभी आपके लिए एक रिसोर्स बन सकते हैं। तो आप इन इम्पॉर्टेंट चीज़ों को भी अपने विलेज मैप्स में प्लॉट कराएं। तो हर सब सेंटर में उनके विलेजेस का मैप होना अनिवार्य है, और इसमें CHO की बहुत बड़ी जिम्मेदारी है।
Yes, Dr. Nidhi, you have explained very well about the village and how, as a student, you are going to take the help of various workers working in the community like ANM or ASHA worker or Anganwadi workers, etc., so that you can identify these community resources available, and because you have to take their help when you are being involved in various activities under national health programs like TB elimination program. Nowadays active TB surveillance is going on, and you are getting this data collected through these workers in the community at grassroots level. So it is very important activity to prepare the map of the village, to identify the various areas, so that it is easy for you in future to work in that village, to get familiar with the village and the environment of that village. Now we will see the various village registers which are being maintained in the village or at the sub-center level. There are various registers maintained to store the various information of the overall picture of the village, and what all number of population in the different age group living in these areas, and the what is the age and sex, and what is the occupation of these households in the village who are part of the village, and a number of health facilities available, because in the village, if you will see the practitioner, various kind of practitioners, RMP practitioners are also there, Ayurvedic doctors are there, homeopathic doctors or the allopathic doctors, as well as our government facilities are also there, to whom which the people living in the village are availing through various sources as per their need. And they have the number of dais in the village, how many dais are there, location of the schools and the panchayat bhavans, and village health, sanitation and nutrition committees are there, which are being the consultative team of the village, which have the grassroots level knowledge about the various the nutrition related problems they discuss. So you can take the help of various these facilities to maintain and the registers in the village and get the information from various people involved in the community. Like household survey register is there. So in that household survey register, the information regarding that particular household is collected, because if in a household there are 5 members in the that household, so everybody is of different age group in different life cycle. Some maybe middle age group, or infant can be there, or a pregnant lady can be there. So that way you can collect the information in the household register. Then eligible couple register is there. So in that you have to take the note of married women in the age group of 15 to 45 years of age. That can be collected, and this information is very important. And as well as when you are, once you have done the household survey, how much it will remain valid. So next time if you are there for more than 5 years, so you will have to take the information, and after 3 years you have to do this survey again, because it is not easy to do every day you change the data. But then after 3 years again one more session of how a survey can be done to see what is the status of household information after 3 years. Then eligible couple register, that is to identify the number of couples where with the wife age is between 15 to 45 years. From the household survey register you can take the data and keep in the eligible couple register. And the family status with the parity number of living children, that you can write there, and the age of the youngest child can also be written in the, because that will help you if the child is just a toddler or a new infant. Then you can even take action, that you can tell them about the spacing methods at the same time or later on. And the couple, if using any contraceptive methods, that information is also very important, which can be collected in the eligible couple register. Next is the sub-center register, where all those patients who are coming in the sub-center with some or the other health problem, that register has to be maintained for the patient, that how many patients you have looked after in the sub-center, and what were their chief complaints, or any medication you have given, and any remarks like you have whether patient had come for the follow-up, or whether you are referring the patient to higher facility, that you can write in the remarks column. Another register is the death register. All the deaths occurring in the area covered by the sub-center can be recorded in the death register, like the date of death, name and address of the person who died, his age, sex, and what was the cause of death can be noted down, because these all information is very important from the point of view of the planners or the policy makers. Next register is the stock register. You get the supply of drugs also in the sub-center. So you can write what is the previous balance which was left of the previous month, then the quantity you received in this month, and what is the quantity which is used for the month, and what is the balance left. So all these things, and if any drug of the previous is getting expired, that also you have to mention regularly, so that you maintain the supply chain of the stock register. Excuse me. So after the stock register, cumulative family folder, what is it? Can you explain?
Yes. So After stock register, again we have this register for recording consultative processes. So when you are there at the sub center, you hold some consultative meetings, and these meetings can be held with the panchayat members, with the village health associations, with mahila samitis. So all these meetings have to be recorded, and some important key points that were discussed in the meeting should be noted down. Now coming to the cumulative family folder or record. Now this family folder or record is for each individual family, and in that this particular record, this is to be kept at sub-center level. You document all the family details, like what is the family structure, the number of vulnerable groups, the types of vulnerable groups, pregnant, geriatrics, 60 years plus geriatrics who are there. So all of that has to be documented. Vitality statistics. Vitality का मतलब है जन्म और मृत्यु. Any birth, any death, marriage, any significant event that has happened in the family, that has to be reported. Environment, फिजिकल या बायोलॉजिकल. फिजिकल बायोलॉजिकल एनवायरनमेंट मतलब कोई अगर ऐसे कोई हजार्डस एरिया में है, कोई रिवर बैंक में है फैमिली जहाँ पे फ्लडिंग के चांसेस हैं, फिजिकल एनवायरनमेंट वहाँ का सही नहीं है. बायोलॉजिकल वहाँ पे कोई बहुत ज़्यादा मॉस्किटो ब्रीडिंग हो रही है, तो वो बायोलॉजिकल एनवायरनमेंट में आपको. तो फैमिली फोल्डर आपके पास एक ऐसा डॉक्यूमेंट है जिसमें आप उस फैमिली के बारे में की इंफॉर्मेशन उनके हेल्थ के लिए और उनके एनवायरनमेंट अफेक्टिंग द हेल्थ के लिए आप उसमें नोट करके रख सकते हैं. साइको सोशल एनवायरनमेंट, कोई डिवोर्स हुआ है फैमिली में, कोई ड्रग एब्यूज़ हो रहा है, कोई डोमेस्टिक एब्यूज़ का केस है, कोई भी ऐसी चीज़ जो है जो आपको लगता है फैमिली में किसी भी मेंबर के लिए हेल्थ बहुत इम्पॉर्टेंट वे में इम्पैक्ट कर सकती है, वो आप क्यूमुलेटिव फैमिली फोल्डर या रिकॉर्ड में रख सकते हैं. मैडम मैम कुछ आप.
Yes. So, when you are assigned even some families, so in that family you can record from start from the head of the family, then the wife, then children. In case it is a joint family, then you can also record the grandchildren, parents also. So you can also identify whether type of family is nuclear family or joint family. And as madam has rightly pointed out that where this family is staying, whether what is the environment around that family, whether it is physical environment or the biological environment. Physical environment, whether the family is neat and clean, environment is also neat and clean, there is no house is well ventilated or not, whether any pets are there, any rat or insects, that you have to observe. It is not that everything they will tell and then only you will write. Some of the things are there that when you have read in the theory, you need to observe the environment of the family when you are going for home visiting, so that this help you to get the additional information that this family is a very maintain personal hygiene as well as the environmental hygiene, family is healthy, having no such problem. But there can be problem due to the some psychosocial aspect. So you have to be keen observer in noting down whether there is some case of drug abuse or any child abuse in the family. That things you have to observe, and sometimes they don't come out with these societal problems like reproductive tract infections. So they directly doesn't communicate about females of the house, they doesn't communicate openly that I am suffering with RTIs or STIs. So in that case you have to develop rapport with them, so that and maintain confidentiality and being having trust in them, and they should also build rapport with you, so that you come out with their hidden health problems also, so that it will be helpful to give them care, because your goal is to help them in maintaining their health. So for that, this family health record will give you the basic information about the family, whether all the children in the family are well immunized or not, whether there is any pregnant lady, if pregnant woman is there, whether early registration has been done or not, because you will take the family as a unit and you are there to look after the whole family. You can't say that I have just come to see the pregnant lady in the house. You have to take cumulative, means you have to take care of all the family members. You have to provide them comprehensive primary health care rather than just meeting specific needs of the family. That way, you are going to maintain all the registers. And one more thing which is very important is the maintaining the daily diary, because we have told you so many registers you have to maintain, but will it be possible for you to carry all these registers with you? And whether you will get eligible couple today or not when you are doing this survey, or whether you will get some other death in the family and you will take death register there, it is not possible to carry every register with you. So that is why it is recommended that you maintain a daily diary. In that daily diary, you keep the information related to, you know what all registers you have to maintain, but the overall information you get down and write down in the daily diary, so that when you come back and when you are recording all this information which you collected during the survey, you can take this particular register with which you have taken the information and fill that register after coming back. So if you got some RTI or STI case, that also you can record in your STI register after coming back to the sub center. So that way the daily diary will help you in maintaining these various registers which are there in the sub center, which you have to maintain, and they registers you have to maintain in clearly in the language which should be simple. Even if you are not there, somebody else comes, they can also read and understand what has been written by you, so that they also come to know the information about the village under which you have taken this record. So till now I think we have covered about the sub-center, mapping the sub-center, how to identify various areas in the village to be familiar with that village or the sub-center, and what all registers you have to be maintaining, and while maintaining these registers, what all things you have to keep in mind, and why you have to maintain these registers is very important. As madam has rightly explained that there will be data you generate, and that data will lead to the information, and from that information or that knowledge, you are going to impart this knowledge or send this knowledge to higher authorities or the policy makers, so that they give certain guidelines and they keep some more budget for that particular activity which is more prevalent in that sub center. So that way it will be helpful to you, helpful to the people in person to whom you are taking care in the sub center. So with this I think we have covered about the digital record manually how we maintain various registers in the sub center. And in the next session, after a short break, we will be discussing about the health information system and the digitalization or the e-health and Ayushman Bharat mission on the digital health also. So with that, we will take small break. Thank you.
Do you wish to be part of a television studio like this, or any other media system, or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism and New Media Studies. Here in the School of Journalism and New Media Studies, we are offering program for all set of people to learn and enhance the media skills. The vision of School of Journalism and New Media Studies is to generate a new set of professionals in the area of media and communication studies with understanding about role of media in the national development and global understanding. We offer innovative programs in the field of journalism and mass communication that sets a benchmark of high quality learning and teaching process at the national level. We offer these programs across the country with the help of our regional network as well as study center. Same manner, many of our programs are offered through online mode with a sophisticated learning management system. SOGNMS offers programs from PhD in journalism and mass communication till certificate level. We have masters in journalism and mass communication. The eligibility is a bachelor's degree, and we are introducing this program in 3 languages: Hindi, Tamil and English. Students from national and international students can join either through online mode as well as in the distance mode. We have 4 postgraduate diploma programs, specialized areas in the field of development communication, digital media, electronic media and journalism and mass communication program. And all these 4 programs are available in distance mode. 2 programs are available in online mode, development communication and digital media. And we have specialized certificate program in community radio. IGNOU employs various media and communication tools for better teaching and learning process. School of Journalism and New Media Studies utilizes this media system for delivering all our programs. Come and join with us for exploring a new career and enhance your media skills.
Welcome to the second session of report writing and IT skills. Today we are discussing BNSL 43, Block 1, Unit 7, report writing. As we have discussed in the previous session about the various registers which are maintained at subcenter level, what all points you have to keep in mind while recording and reporting recording the data in the registers, and how this data is compiled and make information, and this information is shared to the policymakers so that they can plan and give the directions to at the grassroots level as per the need of the common people in the villages. So with this we manually the data is being generated and that has to be recorded and reported. Now we will be discussing about the, as we are in the era of technology, and technology is not even used in many aspects but also in the health. So we will be discussing about the various components of health information system as well as the digital recording of the data, and then how this data is being kept safe and various aspects related to that. So to discuss this topic, we have with us Dr. Nidhi Bhatnagar, Associate Professor, Maulana Azad Medical College. So I invite her and ask her about the various components of health information system. Dr. Nidhi.
Yes, thank you. So now we'll be talking about the health information system. Health information system is the system which captures, stores, manages, retrieves and transmits data. आपने जो आपके और आपके फंक्शनरीज ने जो डेटा कलेक्ट किया है डिफरेंट रजिस्टर्स और जो आपने रिकॉर्ड्स और रिपोर्ट्स बनाए हैं, वो सारे हमें एक सिस्टम में फीड करना है फॉर इट टू मूव अहेड फ्रॉम सब सेंटर लेवल टू प्राइमरी हेल्थ सेंटर टू द स्टेट एंड टू द सेंट्रल लेवल. इस पूरे सिस्टम को हम एक हेल्थ इंफॉर्मेशन सिस्टम कहते हैं. WHO हेल्थ इंफॉर्मेशन सिस्टम के स्टैंडर्ड कंपोनेंट्स बताता है, एंड दोज कंपोनेंट्स आर: the health information system should capture demography and vital events, environmental health statistics, information about health status like mortality, morbidity, disability, and quality of life, information about health resources like facilities, beds, and manpower availability, utilization and non-utilization of health services like attendance, admission, and waiting lists, indices of outcome of medical care, how many people survived, what has been the survival rate, financial statistics like cost and expenditure or on care, and any other information related to defined objectives.
Yes, as Madam has told about the various aspect of health information, how you collect the health related information, and that information is being transmitted further from the primary health center to maybe community health center or at district level, and from district level it reaches to state level, and from there it reaches to the center level. So that data has been transmitted. Now how do you collect all this information? Various aspect of information like morbidity, mortality, about vital statistics and all. So there are various sources of health information data which are being collected. So first of all is our census. As everybody knows that every decade, after a decade or after every 10 years, the census are being conducted. From door to door data is collected on various aspects of the demographic data, socio economic data of the population, and illiteracy level. Every data is being collected through census. Other source is the registration of vital events like any death or any birth which occur in any, whether it is occurring at home or in the institution, it has to be registered as birth data or the death data. So that is the another source of getting this in registration of vital events which give the information. Then notification of there are many diseases which are notifiable, like COVID. It was a notifiable disease, so anybody suffered with COVID has to be notified. Tuberculosis is another notifiable disease. It is mandatory to send this data if anybody is having tuberculosis. So from there this data about the disease can be collected. Then hospital record. Patients who are admitted in the hospitals, they have some or the other illness. So the hospital records are another source of information for collecting the data related to the morbidity and mortality. Then disease registers, various disease registers. Suppose there is a diabetic clinic take place, so all patients suffering with diabetes attending a diabetic clinic, patients suffering with hypertension, so disease specific registers are also being maintained, and they are the source of health information. Then there are various records, linkages. Then epidemiological surveillance. When epidemiological surveillance take place in the community, like for the pulse polio immunization, if any child left not with polio immunization, the epidemiological survey tell that whether the coverage is 90% or any child left to be given polio. So that information can be as a good source of health information. Then other health records, environmental health records, then health manpower statistics, like you get the nurse patient ratio or health doctor patient ratio. So that also can be analyzed through these records, and other routine surveys related to health as well as non-quantifiable information. So all these are the sources of health information which we generate data out of it. So now what are the uses of health information? We have collected so much of data. What is the use of this data?
So all this data that has been fed into the health information system can be used to measure the health status of the people and quantify the health problems and medical health care needs. It can be used for local, national, and international comparisons, for planning, administration, and effective management of health services and programs, to assess whether health services are accomplishing their objectives. So, we have set milestones in the programs, we have set targets for elimination and eradication of diseases, we have set targets for reducing IMR, stillbirth rate, neonatal mortality rate. So, whether these targets are being achieved or not, to assess the attitudes and degrees of satisfaction of beneficiaries, how much, if you have improvement in quality of life, if you have improvement in quality of antenatal care. So this shows the satisfaction of beneficiaries, and then research into problems of health and disease. Now we come on to the technological part of health information system, and one of the first platform where technology was introduced was maternal and child tracking system. It is a beneficiary-specific database for maternal and child health services and is delivered through the Indian public healthcare system, which is from sub-center to the central level. It was launched in 2009 and was a part of global trend towards harnessing e-health innovation. E-health is electronic health innovations, and the focus is improving service delivery, and it was started as a mission mode project under Government of India's National E-Governance Plan. And the aim of MCTS is to design, the design is to capture and track all pregnant women, that is from conception up to 42 days postpartum, because we wanted to capture all maternal mortality, which takes women till 42 days after delivery. So इसलिए conception से लेके 42 days after delivery तक सारे mothers को digitally follow up करना, including their newborn children up to 5 years of age. So this will, your beneficiary group will include antenatal women, postnatal women, and women for immunization. So all your services related to antenatal, postnatal, and immunization can be followed up through this maternal and child tracking system. And data acquired from MCTS cell indicated that the registration rates were reasonable, not very good. It stood at 63% for pregnant mothers and 59% for children. Now this is the data flow which you see for mother and child tracking system. तो पहले लेवल पे जो है विलेज और सब सेंटर लेवल पे आपकी आशा या ANM जो है आपकी बेनिफिशियरी को आइडेंटिफाई करेगी, आपकी फ्रंट लाइन हेल्थ वर्कर. वहाँ से आपके जो RCH रजिस्टर्स हैं उनमें उनकी डिटेल्स रिकॉर्ड होंगी, जिनके बारे में हमने आपको पहले सेशन में बताया. रिकॉर्डिंग ऑफ डिटेल्स ऑफ मदर एंड चाइल्ड इनटू प्राइमरी डेटा टूल. इसमें कई बार रजिस्टर्स हैं, कई बार अब हम आगे इसमें डिस्कस करेंगे अनमोल ऐप्स भी आ गई हैं जो स्मार्टफोन के थ्रू या टैबलेट के थ्रू ANM एंटर कर रही है. अब वो माध्यम भी काफ़ी जगह इंट्रोड्यूस हो चुका है. और इसके बाद ये इन्फॉर्मेशन जो है वो PHC लेवल पे या ब्लॉक लेवल पे जो हमारा प्लेटफॉर्म है MCTS प्लेटफॉर्म, वहाँ पे उसकी एंट्री हो जाती है. डेटा एंट्री पर्टेनिंग टू न्यू रजिस्ट्रेशन. और इसके बाद आप देखिए कि ये जो इन्फॉर्मेशन है ये एक वर्क प्लान जनरेट करती है, प्रिपरेशन ऑफ वर्क प्लान फॉर सर्विस डिलीवरी, एंड दिस वर्क प्लान इज शेयर्ड विद ANM फॉर विलेज हेल्थ एंड न्यूट्रिशन डे सेशन. तो ANM को इस वर्क प्लान से एक आइडिया लग जाता है कि एक पर्टिकुलर मंथ में उसको कितनी बेनिफिशरीज को फॉलो करना है, कितनों को एंटीनेटल केयर देना है, कितनों को पोस्टनेटल केयर देना है, कौन से बच्चे की इम्यूनाइजेशन चेक करनी है. तो ये हमारा 2-वे फ्लो होता है MCTS में. और ये इन्फॉर्मेशन जो है ये डैशबोर्ड के थ्रू जो रिपोर्ट है ये आपके ऑटोमेटिकली डिस्ट्रिक्ट एंड स्टेट लेवल पे भी चली जाती है और आगे नेशनल लेवल पे भी जाती है. लेकिन इसके कुछ बहुत महत्वपूर्ण चैलेंजेस हैं. सबसे बड़ा चैलेंज पुअर प्राइमरी डेटा कि ग्रास रूट लेवल पे ही अगर आपकी बेनिफिशियरी पूरी तरह से आइडेंटिफाई नहीं हो रही हैं. बहुत सी प्रेग्नेंट लेडीज़ अपने आप को अर्ली रजिस्ट्रेशन नहीं कराती हैं, टाइमली नहीं बताती हैं कि वो प्रेग्नेंट हैं, क्योंकि बहुत से कल्चरल टैबूज़ जुड़े हुए हैं इसके साथ. उनको लगता है उनके बच्चे को या प्रेग्नेंट गर्भवती महिला को नज़र लग जाएगी. तो इन कारणों की वजह से वो हमारे रजिस्ट्रेशन हमारे पब्लिक हेल्थ केयर सिस्टम के एम्बिट में नहीं आती हैं. तो हमारे पूरे MCTS सिस्टम के ही वो बाहर चली जाती हैं. हम पूरा MCTS भी उनको कैप्चर नहीं कर पाता क्योंकि प्राइमरी डेटा में वो रिकॉर्डेड नहीं है. टाइम लैग इन अपडेशन ऑफ पोर्टल। आपने प्राइमरी डेटा कलेक्ट कर लिया, आपके फ्रंटलाइन वर्कर्स ने आपको इन्फॉर्मेशन ला के दे दी कि इतने वुमेन जो हैं हमारे प्रेगनेंसी के लिए रजिस्टर्ड हैं, पर उसको डेटा में अपलोड करने के लिए प्रॉब्लम है, डिले है। डिले के बहुत कारण हो सकते हैं। आपके पास डेटा एंट्री ऑपरेटर नहीं है, आपके पास जो ब्लॉक लेवल पे सुविधा होनी चाहिए, इलेक्ट्रिसिटी होनी चाहिए, इंटरनेट होना चाहिए, वो नहीं है, आपकी मशीनरी काम नहीं कर रही है। इन कारण, या आप सब सेंटर से पीएचसी जाने में आपको बहुत टाइम लग गया क्योंकि आप बिज़ी हो गए सब सेंटर लेवल पे। बहुत से ऐसे कारण आ सकते हैं जिसकी वजह से अपडेशन में चैलेंज आ रहा है और इसकी वजह से वर्कलोड जनरेट करना, शेड्यूल जनरेट करने में डिले हो सकता है। इससे आप क्वालिटी ऑफ सर्विसेज नहीं मेजर कर सकते। नॉट एबल टू मेजर क्वालिटी ऑफ सर्विसेज। आपकी सर्विसेज की क्वालिटी क्या है, नंबर्स में आपको आपकी जानकारी है, पर क्वालिटी ऑफ केयर जो आजकल बहुत इंपॉर्टेंट है उसके बारे में हमें कोई इन्फॉर्मेशन नहीं मिल रही। स्टैंडर्डाइज रजिस्टर्स एंड फॉर्मेट्स नीडेड। हर स्टेट में हेल्थ इज़ अ स्टेट सब्जेक्ट, इसके बारे में आपको पता है। हर स्टेट अपने हेल्थ के फॉर्मेट्स अपने तरीके से मॉडिफाई करता है। MCTS एक सेंट्रल लेवल प्रोग्राम है, उसका डैशबोर्ड सेंट्रल तरीके से बना हुआ है, तो कुछ स्टेट्स में ये डिस्पेरेंसी है और इस वजह से हमें प्रॉब्लम होती है MCTS के डेटा को वो एक सामंजस्य जोड़ना कि भाई जो हमारा रजिस्टर है और वो डैशबोर्ड में एंटर हो। कुछ इन्फॉर्मेशन कई बार नहीं मिलती। एंड गाइडलाइंस टू क्लियरली ले आउट अ प्लान फॉर डेटा कलेक्शन, कंसोलिडेशन एंड ट्रांसफ़र। वो एक स्ट्रिक्ट टाइमलाइन हो कि कब डेटा कलेक्ट हो, टाइमली अपडेट हो, टाइमली शेड्यूल जनरेट हो, उसके स्ट्रिक्ट टाइमलाइंस को मेंटेन करना वो भी एक बहुत बड़ा चैलेंज है और हर जगह नहीं हो पा रहा है। अब हम इस सेशन का एंड करेंगे लास्ट में कुछ बहुत इम्पॉर्टेंट रिसेंट इनिशिएटिव्स के बारे में बात करते हुए। सबसे इम्पॉर्टेंट और सबसे बड़ा इनिशिएटिव जो हेल्थ इंफॉर्मेशन सिस्टम को एक तरीके से रिवैम्प कर रहा है वो है आयुष्मान भारत डिजिटल मिशन। ये नेशनल डिजिटल हेल्थ मिशन के नाम से शुरू हुआ था और इसका फोकस है क्रिएटिंग अ डिजिटल हेल्थ इकोसिस्टम फॉर द एंटायर कंट्री। इसमें कुछ बहुत इंपॉर्टेंट कंपोनेंट्स हैं, इसके बारे में हम आगे और विस्तार में बात करेंगे, बट आप थोड़ा सा समझ सकते हैं इस फिगर को देख के। इसमें एक हेल्थ आईडी कार्ड जनरेट होगा जिसको हम आभा नंबर भी कहते हैं, आयुष्मान भारत हेल्थ अकाउंट नंबर, जो हर एक सिटीज़न का अपना नंबर जनरेट होगा जो हमारा ये पोर्टल जनरेट करेगा। इसके द्वारा आप टेलीमेडिसिन कर सकते हैं, आप डिजी डॉक्टर अपने एक पर्सनल डॉक्टर के साथ कंसल्टेशन कर सकते हैं, डॉक्टर्स की भी रजिस्ट्री होगी, हेल्थ फैसिलिटी रजिस्ट्री भी होगी। इसमें डिफरेंट पब्लिक एंड प्राइवेट दोनों जितने भी हेल्थ फैसिलिटीज़ हैं, हेल्थ प्रोवाइडर्स हैं, जिसमें आपके एलोपैथिक, आयुष सारे प्रैक्टिशनर्स का एक रिकॉर्ड या एक रजिस्ट्री होगी। इसमें आपके पर्सनल हेल्थ रिकॉर्ड्स का भी एक हेल्थ लॉकर करके एक क्लाउड में स्पेस दिया जाएगा जिसमें आप अपने पर्सनल हेल्थ रिकॉर्ड्स को भी स्टोर कर सकते हैं और इसमें फार्मेसी की भी सुविधा आगे के समय पे उपलब्ध की जाएगी। इस प्रोग्राम का विजन है to be inclusive, accessible, affordable and efficient digital health infrastructure across the country in a safe and time-bound manner. इसमें हर सिटीज़न का एक अपना आभा नंबर होगा, हर डॉक्टर एनरोल्ड होगा, हर पब्लिक या प्राइवेट हेल्थ फैसिलिटी की रजिस्ट्री होगी। तो ये इसका एंटायर फोकस हमारा यूनिवर्सल हेल्थ कवरेज की तरफ है। मिशन है टू क्रिएट अ डिजिटल प्लेटफॉर्म फॉर इवॉल्विंग हेल्थ इकोसिस्टम थ्रू अ वाइड रेंज ऑफ डेटा इंफॉर्मेशन एंड इंफ्रास्ट्रक्चर। और इसमें क्योंकि आपका इतना सारा डिजिटल डेटा जनरेट होगा तो इसमें सिक्योरिटी, कॉन्फिडेंशियलिटी और प्राइवेसी की को भी बहुत तवज्जो दिया गया है, बहुत इंपॉर्टेंस दी गई है। अब इसके बारे में थोड़ी सी हिस्ट्री पढ़ते हैं क्योंकि ये बहुत बड़ा मिशन है इंडिया का और बहुत रिसेंटली लॉन्च हुआ है और हेल्थ इंफॉर्मेशन सिस्टम और हेल्थ डेटा से डायरेक्टली इसका मेल है। ये एक डिजिटल इंडिया मिशन 2015 में आया था जिसमें सारे हेल्थ केयर सारे प्रोग्राम्स को डिजिटलाइज किया गया था, चाहे वो एग्रीकल्चर हो, चाहे वो एजुकेशन हो, चाहे वो बैंकिंग हो, चाहे वो टूरिज़्म हो, चाहे वो एजुकेशन हो, सब में एक तरीके से इंडिया ने डिजिटलाइजेशन की कोशिश एक शुरुआत की थी और इसमें हेल्थ भी जुड़ा हुआ था और वहाँ से हमारा नेशनल डिजिटल हेल्थ मिशन की शुरुआत हुई। नेशनल हेल्थ पॉलिसी के बारे में आप सबने अभी तक पढ़ लिया होगा, ये 2017 में आई है और नेशनल हेल्थ पॉलिसी में इसके बारे में बहुत विस्तार से लिखा हुआ है और ये कहा हुआ है कि it envisage the creation of digital health technology ecosystem which aimed at developing integrated health information system for enhancing the efficiency and effectiveness of healthcare services. तो हमारे हेल्थ केयर सर्विसेज में बहुत सी कमियां हैं, उनकी एफिशिएंसी और इफ़ेक्टिवनेस कि आपका इंफॉर्मेशन फास्ट फ्लो हो, सब सेंटर से सेंटर के तरफ आपकी इंफॉर्मेशन की स्पीड फास्ट हो, एक्यूरेट हो, और आपस में इंफॉर्मेशन एक्सचेंज बहुत फास्ट हो। इसके लिए हमें और आपके सारे हेल्थ प्रोवाइडर और हेल्थ बेनिफिशियरी आपके एक प्लेटफॉर्म में आए, इसके लिए नेशनल हेल्थ पॉलिसी ने अपनी स्टेटमेंट में कहा। और इसके बाद नीति आयोग ने नेशनल हेल्थ स्टैक 2018 में स्टार्ट किया, नेशनल डिजिटल हेल्थ ब्लूप्रिंट बना 2019 में, और फिर नेशनल डिजिटल हेल्थ मिशन की शुरुआत हुई 15 अगस्त 2020। अगर आप उसमें हमारे प्रधानमंत्री नरेंद्र मोदी जी का स्पीच सुनेंगे, उसमें उन्होंने ये मिशन को डिक्लेयर किया। इस पे बहुत डिबेट हुई कि अभी हमें इतना बड़ा कदम नहीं लेना चाहिए, लेकिन अब नेशनल डिजिटल हेल्थ मिशन बहुत फास्ट पेस में ग्रो कर रहा है, और यूनिवर्सल हेल्थ कवरेज का टारगेट है हमारा इस मिशन के थ्रू। इसके आर्किटेक्चर के बारे में अगर हम बात करें, ये बहुत कॉम्प्लिकेटेड है, पर आपको मैं इसके बारे में बहुत सिंपल तरीके से बताऊंगी। ये जितने भी आपके एप्लीकेशंस हैं, जो आप स्मार्टफोन में एप्लीकेशंस होते हैं, जैसे आपका आरोग्य सेतु है, कोविन है, टेलीमेडिसिन के बहुत सारे आजकल ऐप्स आ रहे हैं, ये सारे आपके एप्लीकेशंस जो हैं ये हेल्थ बेनिफिशियरी के, जो बेनिफिशियरी हैं, हम बेनिफिशियरी हैं, हमारे एप्लीकेशंस हैं। दूसरे लेवल पे कुछ ऐप्स ऐसे होते हैं जो हेल्थ प्रोवाइडर के एप्लीकेशंस होते हैं, जैसे आपका HMIS है, हेल्थ मैनेजमेंट इंफॉर्मेशन सिस्टम, लैब मैनेजमेंट इंफॉर्मेशन सिस्टम, और टेलीमेडिसिन जो आपको गवर्नमेंट के थ्रू भी आ सकती है, पब्लिक हेल्थ के प्रोवाइडर, प्राइवेट हेल्थ के प्रोवाइडर, इनके थ्रू आ सकती है। इन ऐप्स के थ्रू आप एक यूनिफाइड हेल्थ इंटरफेस में जाते हैं। मतलब ये ऐप्स जो हैं, इनमें ये इसके थ्रू आप कोई सर्विस अवेल कर सकते हैं, पैसे पे करना है, कोई सर्विस बुक करना है, और उससे आप सर्विसेज ले सकते हैं। सर्विसेज का रेंज प्रिवेंटिव हो सकता है, ट्रीटमेंट हो सकता है, डायग्नोस्टिक हो सकता है, फार्मेसी हो सकती है, बहुत रेंज ऑफ सर्विसेज हैं। अब ये जो यूनिफाइड हेल्थ इंटरफेस है, जो ये आप बीच में लाइन देख रहे हैं यूनिफाइड हेल्थ इंटरफेस का, ये जो इंडिविजुअल और इन हेल्थ प्रोवाइडर ऐप्स के नीचे है, इसमें आपके कुछ सॉफ्टवेयर्स हैं और कुछ प्रोटोकॉल्स हैं। और ये प्रोटोकॉल्स जो है, ये आयुष्मान भारत डिजिटल मिशन में ये ओपन प्रोटोकॉल्स हैं, जिनमें पूरी सिक्योरिटी है, पूरी प्राइवेसी है, पूरी कॉन्फिडेंशियलिटी है, पर साथ में इंटर ऑपरेबिलिटी ऑफ डेटा है, नेसेसरी डेटा विथ नेसेसरी चेक्स मूव। और ये जो प्रोटोकॉल्स हैं, ये डिजिटल पब्लिक गुड्स, मतलब ये जो हैं ये ओपन हैं, ये यूज़ करने के लिए हैं, और ये ऐसे फ्लेक्सिबल हैं कि ये आपके इंडिविजुअल ऐप्स और हेल्थ प्रोवाइडर ऐप्स के साथ मिल जाएंगे। इसमें ये चैलेंज नहीं होगा, ये ऑब्स्ट्रक्शन नहीं होगा। और इसके साथ साथ इसमें इस पूरे सिस्टम में आपके, जो मैंने पहले बताया, इसमें आपके डिजिटल रजिस्ट्रीज़ हैं, जिसमें आपका आभा रजिस्ट्री है, जो आभा आपकी हर एक सिटीज़न का एक आभा नंबर है, एक उसमें उसकी एक पहचान होगी। हेल्थ के प्रोफेशनल्स की भी रजिस्ट्री है, हेल्थ फैसिलिटीज़ की भी है, ड्रग्स की भी है, एसेंशियल ड्रग लिस्ट्स भी रहेंगी, आपके हेल्थ रिकॉर्ड्स रहेंगे। और अगर आप प्राइवेट हेल्थ केयर सर्विसेज लेते हैं, अगर आप इंश्योरेंस लेते हैं, तो उसमें हेल्थ क्लेम्स का भी जो डेटा है वो भी आपका इसमें उसकी भी वो है। और ये आपके हेल्थ बिल्डिंग ब्लॉक्स हैं। और इसके साथ साथ ये आपका सिर्फ हेल्थ तक नहीं रिस्ट्रिक्ट रहेगा, हेल्थ सिस्टम तक नहीं रिस्ट्रिक्ट रहेगा, इसमें आपकी लिंकिंग है आपके आधार नंबर से, आपके UPI से, आपके डिजिटल सिग्नेचर से। तो इसका मतलब ये है कि जो आपके बाकी जो आपके सेक्टर्स में जो टेक्नोलॉजिकल या एडवांसमेंट्स हो रही है, ये उसके थ्रू भी आपका उसमें भी आपका कनेक्शन बन रहा है। तो ये मेन जो डिफरेंस आया है, अगर आप बताएं सिंपल शब्दों में अगर हम बात करें डिजिटल हेल्थ मिशन से, तो वो ये रहा है कि पहले जो प्रोटोकॉल्स हैं, अगर आप ये स्लाइड देखें, इसमें पहले एक पेशेंट है, वो टेलीमेडिसिन लेता है एक डॉक्टर से या अस्पताल से, उसका अपना प्रोप्राइटरी प्रोटोकॉल है, वो एक अपने तरीके से, एक अपना सॉफ्टवेयर उनका अलग है जिससे वो ये काम करते हैं। दूसरा हॉस्पिटल का अलग है, लैब का अलग है, ये तीनों अलग अलग हैं जो अलग अलग ऑपरेट कर रहे हैं। बट अब आयुष्मान भारत डिजिटल मिशन के द्वारा एक जो ये प्रोटोकॉल्स हैं, इनकी आपस में बात होगी, एक इंटर ऑपरेबिलिटी ऑफ डेटा होगा, एक हॉस्पिटल दूसरे हॉस्पिटल से डेटा ले पाएगा नेसेसरी चेक्स के बाद, कॉन्फिडेंशियलिटी एंड प्राइवेसी इंश्योर करते हुए। और इस डेटा की ओनरशिप पेशेंट के पास रहेगी, पेशेंट का पूरा राइट रहेगा कंसेंट देना या नहीं देना। तो ये जो ओपन प्रोटोकॉल्स हैं, जो इंटरऑपरेबिलिटी इंश्योर कर रहे हैं सिक्योरिटी के साथ, यही हमारा यूनिफाइड हेल्थ इंटरफेस है जो हमें डिजिटल हेल्थ मिशन के द्वारा मिला है। और हेल्थ सिस्टम में बहुत तरीके से बदलाव आ रहे हैं। जैसे इलेक्ट्रॉनिक हेल्थ रिकॉर्ड्स। अब जब आप देख रहे हैं कि हमारा आयुष्मान भारत डिजिटल मिशन में भी ये चीज़ की शुरुआत हुई है, इसमें इलेक्ट्रॉनिक हेल्थ रिकॉर्ड्स, इलेक्ट्रॉनिक मेडिकल रिकॉर्ड्स, तो जो भी आपके रिकॉर्ड्स हैं, जो पहले आप रजिस्टर्स और रिपोर्ट्स जो आप सब सेंटर में मैनुअली आपने रजिस्टर मेंटेन किया था, वो वहीं पर है, लेकिन जो ये रिकॉर्ड्स हैं ये आपके स्टोर हो जाएंगे सिस्टम में, क्लाउड्स में स्टोर हो जाएंगे और ये आपके वहाँ सिक्योर और सेफ़ रहेंगे। ये आपके प्रिस्क्रिप्शंस हो सकते हैं, लैब रिपोर्ट्स हो सकते हैं, रेडियोलॉजी रिपोर्ट्स हो सकती हैं, जो आपके इलेक्ट्रॉनिक वर्जन में सेव्ड रहेंगी। एक और बहुत इंपॉर्टेंट टर्म है जो आजकल यूज़ हो रहा है, वो है क्लिनिकल डिसीजन सपोर्ट सिस्टम। सो क्लिनिकल डिसीजन सपोर्ट सिस्टम एक सॉफ्टवेयर है जो आपका एविडेंस बेस्ड मेडिसिन प्रैक्टिस करने में हेल्प करता है। इस सॉफ्टवेयर के थ्रू आप जो लेटेस्ट गाइडलाइंस हैं, जैसे हाइपरटेंशन की लेटेस्ट गाइडलाइंस क्या हैं, अगर वो गाइडलाइंस इस सॉफ्टवेयर में फेड रहेगा और एक जो ट्रीटिंग डॉक्टर है वो जब पेशेंट्स की डिटेल डालेगा, रिस्क फैक्टर्स डालेगा, सारी इन्फॉर्मेशन डालेगा, तो सॉफ्टवेयर भी उसको सजेस्ट करेगा कि आप ये वाली दवाई इस पेशेंट को दीजिए, बिकॉज़ ये दवाई जो है ये क्लिनिकली बेनिफिट इसमें मिला है और इस टाइप के हाई रिस्क ग्रुप में ये दवाई का ट्रायल्स के माध्यम से ये दवाई बहुत अच्छी पाई गई है। तो ये जो क्लिनिकल डिसीजन सपोर्ट है ये डॉक्टर के लिए ये इलेक्ट्रॉनिक मेडिकल रिकॉर्ड्स के थ्रू, और जब हम टेक्नोलॉजी का यूज़ करते हैं तो इसमें डॉक्टर को एविडेंस बेस्ड मेडिसिन प्रैक्टिस करने में बहुत हेल्प होगी। जो हमारे पेरिफेरी के डॉक्टर्स हैं जिनको कई बार वो अपडेट नहीं रह पाते, कई बार उनको हेल्प की ज़रूरत पड़ती है, तो क्लिनिकल डिसीजन सपोर्ट सिस्टम आजकल समय के साथ हम अडॉप्ट कर सकते हैं। आर्टिफिशियल इंटेलिजेंस, मशीन लर्निंग, ये भी बहुत इसके पायलट बहुत सी जगह हो रहे हैं और इसका बहुत रूप में हेल्थ में हम यूज़ कर सकते हैं। जब आपका बहुत बड़ा डेटा है, जिसको हम बिग डेटा भी कहते हैं, बिग डेटा जब आपके पास करोड़ों का सैम्पल साइज़ है, करोड़ों का डेटा है, तो उस डेटा का एक पैटर्न देखते हुए कि उस डेटा का क्या पैटर्न है, आप बहुत सी चीज़ें सीख सकते हैं। बहुत सी इन्फॉर्मेशन आपके लिए जो है, आपको ज्ञान, जो हमने डेटा, इन्फॉर्मेशन, नॉलेज, विजडम की बात की थी, लेकिन जब इतना बड़ा डेटा होता है तो मैनुअली एक इंडिविजुअल के लिए, एक एक्सपर्ट के लिए इसको समझना बहुत मुश्किल हो जाता है। और इसीलिए हम आर्टिफिशियल इंटेलिजेंस, कंप्यूटर की इंटेलिजेंस या मशीन लर्निंग, तो मतलब आप ये समझ लीजिए मशीन लर्निंग कुछ नहीं है। हम 10,000 या 50,000 पेशेंट से हम मशीन को समझाएं कि भाई ये अगर एक्सरे में ये फाइंडिंग आएगी तो इसका मतलब जो है उसको ट्यूबरक्लोसिस है। वो 5,000 पेशेंट्स के एक्सरे को देखेगा और फिर वो याद कर लेगा कि अगर ऐसी फाइंडिंग आ रही है एक्सरे में, इतने टाइप्स की फाइंडिंग आएगी, तो ये मेरे को टीबी की डायग्नोसिस बतानी है। अब उस 5,000 की जगह अब अगर आप उसको 1,00,000 का एक्सरेज फीड करेंगे तो वो 1,00,000 के एक्सरे में से आपको कुछ सिफ्ट करके बता देगा कि भाई इतने एक्सरेज में ये वाली फाइंडिंग आई, तो शायद इन एक्सरेज में टीबी हो सकता है। मैं आपको बहुत सिंपल टर्म्स में बता रही हूँ। इसी को हम मशीन लर्निंग कहते हैं। आपने मशीन को याद करा दिया और फिर वो मशीन लर्निंग आपने बिग डेटा में यूज़ किया डायग्नोसिस के लिए। कुछ और शब्द आ रहे हैं जैसे रेडियोमिक्स और जीनोमिक्स। ओमिक्स कुछ नहीं है, ओमिक्स का मतलब बिग डेटा होता है। रेडियोमिक्स मतलब रेडियोलॉजी। जैसे अब आप ये सोच लीजिए कि हम बहुत बड़ा डेटा है, अगर हमारे पास बहुत सारे लोगों की एक्सरे फाइंडिंग है, एमआरआई फाइंडिंग है, और इन एक्सरे और एमआरआई फाइंडिंग में हम और भी इंफॉर्मेशन लगा दें, जैसे हम उनका डेमोग्राफी लगा दें, उनका रिस्क फैक्टर लगा दें, उनकी डाइट लगा दें, और फिर हम उससे कोई इन्फॉर्मेशन निकालना चाहें, तो हमें ये पता चल जाएगा कि अगर ये डेमोग्राफी है, ये एक्सरे फाइंडिंग है, तो चांसेस है कि ये ब्रेस्ट कैंसर होगा। तो रेडियोमिक्स में आप बड़ा डेटा हैंडल कर रहे हैं रेडियोलॉजी के रिलेटेड, जीनोमिक्स में आप जीनोमिक्स का डेटा हैंडल कर रहे हैं, और ऐसे ही ये इमर्जिंग न्यू फील्ड्स हैं। लास्ट में दो बहुत इम्पॉर्टेंट टर्म्स जो आजकल सामने आ रहे हैं वो है पार्टिसिपेटरी डिजीज़ सर्विलेंस। इसमें भी टेक्नोलॉजी का यूज़ हो रहा है, कोविड में इसका बहुत यूज़ हुआ है। ये एक एक्टिव सर्विलेंस है। पार्टिसिपेटरी डिजीज़ सर्विलेंस इज़ एक्टिव बिकॉज इसमें हम लोगों को कहते हैं कि भाई आप बताइए हमें आपको बीमारी है, आरोग्य सेतु आप इंस्टॉल करिए, आप आरोग्य सेतु से आप के केस डिटेक्शन हो रहा है, और ये आपका एक एक्टिव सर्विलेंस है। तो
So, people participation is important, and as we have discussed today, two modes of data generation through manually at village level, and the same thing can be now through digital mode. We can get the information about the health related facts for the which will be beneficial to the community. That information will be helpful to the policymakers. So as a CHO, your role will be to generate the accurate data from the villages. With this, I thank Dr. Nidhi for giving us updated information about the report writing and information and technology. Thank you very much for the contribution.
Thank you. Namaste.
In the current global economy and digital era, learn or perish is the order of the day for all adults in all sectors of life. As a result, adult education and lifelong learning have assumed great significance. IGNOU as a national university has played its role by way of coming up with the Master of Arts in Adult Education program, MAAE.
MAAE program focuses on different aspects of theory and practice, policies and programs, as well as research, among other things related to adult education.
MAE is a 2-year modular program with multiple entry and exit options. Students who complete first year of the program will be awarded with the postgraduate diploma in adult education. In case they want to continue, they will complete second year program and they will be awarded with the Master of Arts in adult education.
MAE program consists of 10 courses, 5 courses in each year, 8 theory courses, 6 credits worth, and 1 practical course of 10 credits in the first year and 1 dissertation course of 10 credits in the second year.
Practical course of MAAE is divided into 3 components, namely community-based practical activities, workshop-based practical activities, and adult education training center or institution-based practical activities. And the student has to complete all the 3 components for completion of this practical course.
The minimum qualification required for admission to this program is bachelor's degree from any recognized university. The minimum duration is 2 years and the maximum duration is 4 years.
Instructional system follows multimedia approach. The major medium of instruction is self-learning print materials, which is supplemented by other media such as audio video programs, broadcasting, that is interactive radio counseling, teleconferencing, personal contact programs or counseling sessions at the study centers, workshops and field work, as well as internship at the institutional level.
Those who seek out a master's degree in adult education have a myriad of career and specialization options. They can go further for higher studies, that is research in various fields of adult education, an adult literacy teacher, faculty in university departments of adult and continuing education, extension and lifelong learning. Field functionaries in the projects implemented by state and central governments as well as NGOs. For more details, you can log on to
www.ignou.ac.in.
Don't forget to take admission. Hurry up.
Hello friends, are you interested to pursue MA Education program? School of Education, Indira Gandhi National Open University offers a quality MA Education program, and this is one of the popular program of IGNOU. This program has awarded as the best master degree program of IGNOU. Let us focus upon the objectives of the program. To enable learners to understand and appreciate knowledge structures and paradigms of education, to make learners understand education as a discipline from different contexts and perspectives, to develop professionals for effective participation in educational actions and discourses in different areas of education, and to create a community of scholars adequately equipped for participation in educational discourses. Friends, MA Education program has wider career opportunity and placement. After pursuing MA Education program, you can appear UGC NET and JRF in education discipline. You can also pursue PhD in education discipline. After pursuing MA Education program, you can be a faculty in the liberal discipline of education, and you can also be a faculty in teacher education institutions with a BEd degree along with your MA Education degree. You can also be an educational entrepreneur, and you can also work in different national and international organizations just like Commonwealth of Learning, UNESCO, UNICEF, World Bank, and also different research institutions. The eligibility of the program is a bachelor's degree from any recognized university. This program is of minimum duration of 2 years and maximum duration is of 4 years. Medium of instruction is English. However, the learners can write their assignment, term and examination, dissertation proposal and dissertation report in Hindi language. The program is offered in both the sessions of January and July as per the IGNOU practice. Now let us go through the courses that you have to study in the first year and second year of your program. Both continuous and term and evaluation processes are adopted in MA Education program. 30% credit is given to continuous assessment, that is the course-wise assignments, and 70% weightage is given to term and examination that are conducted in the month of June and December every year. So far as dissertation is concerned, dissertation report will be evaluated, and at the same time viva-voce examination will be taken for your dissertation course. For further information, you can write to the program coordinators, Professor Nirod Kumar Das. You can also write to me, Dr. Niradhar De. For more detail, you can go through the common prospectus which is uploaded in IGNOU website www.ignou.ac.in. Why wait? Come and join with us and enjoy happy learning.
Are you interested in television journalism or radio journalism or online journalism? Or do you want to learn with the flexibility of open learning? Or if you are a working professional, wants to enhance your knowledge and skill with certification in the field of electronic media, then School of Journalism and New Media Study IGNOU offers PG Diploma in Electronic Media for you. This program includes audio and audio-visual program production for
Good evening, learners. Today we are going to talk about the program MSW Counseling and its fieldwork components. So here today we have Dr. Kannappa, Assistant Professor with us. So we will be discussing about MSW Counseling Program in detail and also the various fieldwork components. Now let us just see what is counseling program and why student has to enroll for this program.
Yes, ma'am. Let us understand, each very important components one by one. This is a program we run, every semester. Master of Social Work provides both academic learning and professional education and training in counseling, extending beyond theoretical knowledge. It is a tailored to suit counselors working in wide range of organizational community context as well as individual in a family. Unlike in the Western world, counseling services are very inadequate in India. There is a growing demand for counselors in schools, corporate sector, healthcare setting, social and welfare sectors, correctional setting as well as. There are different other sectors where you can use this particular course and the program as well. Students will learn different opportunities and different techniques and different things. Now I'll request my colleague Dr. Ramya to share its salient features.
Yeah, when we say MSW Counseling Program, in Western countries there are like many institutions, other organizations, they are focusing on counseling, and it is very important in the present contemporary world. And when we talk about this MSW Counseling Program, this program we have launched from July 2020 onwards from Hindi. Initially, this program was offered in English, and now it is available in both the medium, English as well as in Hindi. So students can enroll in both the medium. Now let us look at what are the salient features of this program. Like graduates who have done their BA, BSc. So any graduate, they can take admission for this program, and the graduate they should be like they should have got their degree from any recognized university. So such students, they can enroll for MSW Counseling Program, and the students, they can study at their own pace and convenience, and this course is for a period of over 2 to 4 years. That is, the minimum period is 2 and the maximum period is 4 years. So the student can study at his or her own chosen pace, and they are not required to attend regular classes for the theory components. And the practicum, This is done with the local residing area of the candidate. So when they choose the regional center, and in the application form when they are filling, so the option is there, like they can choose the study centers coming under their jurisdiction, and so they can do their practicum. And other features like the print materials, they are supported with audio and video programs. And in IGNOU, one of the important thing is we are using multimedia program package. This is one of the best thing in IGNOU, and every student of MSW counseling, the person is placed under the supervision of a professionally qualified social worker who is having a master's in social work or MA in social work for fieldwork supervision. The student is not he should not take guidance from any other person from other disciplines. So this is mandatory, and this is one of the eligibility criteria for our academic counselors. They should have MSW or MA in social work. And when we look at the courses which provided to the learners, so this course, it actually gives various opportunities to gain knowledge, information, and the much needed skills in order to work with the people in various areas of intervention which requires counseling skill.
Ma'am, I have one question with you. Many learners, they frequently they asked us, can we take supervisors, academic supervisors from different backgrounds in case if they are not finding it? So what is the solution IGNOU can provide for them?
No, actually when we look at the eligibility criteria, only the persons who are qualified, those who have a master's in social work, as I already told you, MA in social work, they are eligible to supervise our students. Because there are many people, there are a lot of institutions, social work institutions, and there are many professionals who are working in the research field, or who are practitioners, who are academicians, teachers. So they can be our academic counselors, and they are the foundation, like strong pillar for our students, and they guide them. So they also involved in taking classes for them. During the COVID time, like they were helping by like online, making use of the social media. So they were helping the students and guiding them. Now everything is back to square, and all this study centers, they are opened. So they are going face to face, and they are getting the guidance and supervision from the concerned person. So this is mandatory that they should have MSW or MA.
So now let's talk on the program structure. The credit system is followed for this program. 1 credit equal means 30 study hours comprising all learning activities. A 4 credit course involves 120 study hours. So a 6 credit course involves 180 study hours, and 10 credit course involves 300 study hours. That means each credit is 30 study hours. It includes different study activities and different other curriculum activities.
Like for example, they are involved in like preparing assignments, and they are attending the theory classes, and they are studying the course materials, and they are going to field work. They are doing their practicum. So they have to put in this many days. Like for example, in the first year they have to put 45 days of field work, minimum 45 days, and in the second year also 45 days, and they have block placement, internships. So altogether, like when you see, they have to put the 1200 hours in MSW, and this will help them to learn the skills. And the student should choose that kind of organization where they acquire counseling skills and also other skills which are really, this will help them in their future, so that when they go to work, or when they are working in a healthcare setting or any other setting, this skills, whatever they have learned during these 2 years, that is going to help them. So they have to take it seriously, and they have to plan it accordingly, because they have to dedicate time. Like after the admission, they will be getting information from the regional centers. From the time, like they will be called for the induction meeting. After the induction meeting, in that induction meeting, they will orient about IGNOU, our courses, and related to social work subjects, about the field work, and who are their academic counselors. So all the information is provided in the study center. So after that, the student like they will be working, like many of our students, they are working a person and they don't get time, so they have to plan accordingly. So from the beginning, after the admission, they have to see that when they are going to do their assignments, and before the term and the exam, theory examination, they have to submit their assignments on time, they have to do their field work, so they have to go to the field, write their reports. So all these takes time, so they have to take it seriously and plan
So
accordingly.
you mean to say that from the time of admission, joining, continuously there will be support system, there will be communication, there will be academic counselors from IGNOU who can support the students.
Definitely. And apart from this, where they are placed, the agency supervisor also help them, and there they learn by practicing the methods like what we are studying in social work, so they will be putting all that into practice.
And another important aspect is to successfully complete MSW program, students will have to earn at least 72 credits over a period of 2 to 5 years. Depending on the convenience of the student as well as the different other system.
Yes, just to interrupt you.
Yes, ma'am.
It is 2 to 4 years. It's a typo error. Earlier it was 5 years. Now it is, the maximum period is 4 years.
Another very important, this particular program will have two major components. One is the theory courses, that is for 40 credits. Another one is a field work practicum, that is the 32 credits. So totally 72 credits this program will have it.
Yes.
So now let's discuss year wise the program details. The first year, MSW 001, origin and development of social work, that is 4 credits course. The second one is MSW 002, professional social work, Indian perspective, 4 credits. The third course is MSW 005, social casework, practicum and supervision, that is 4 credits. The next one is MSW 008, social group work, working with the groups, that is 4 credits. Next one is MSW 009, community organization management for community development, and 4 credits. Next one is MSWL 046, social work practicum, the one. So social work practicum 1 we are going to deal in the first year, that is 8 credits. Next one is MSWL 047, black closement, that is 8 credits. All those things they will have to do it in the first year.
First year, yeah. To add on to that, this MSW 005 social work practicum and supervision, this is the only course which has been developed by IGNOU. No other university has no course on social work practicum and supervision. So that I want to mention.
So in that I think students will learn very in-depth practical aspects.
Yes, all the practical aspects are covered. And you can see many of the universities, they are taking our course materials and they are teaching with our course materials. So this is like all the experts all over, like from all over India, they have written units for IGNOU. And it is one of the best material that we are providing to our learners.
Exactly. Now, another thing what I observed here, from first year itself, they are learning all social work methods. It could be social case work, it could be social group work, community organization, and all this intensely they are learning these methods. Probably that will help them in terms of getting more practical exposure.
Yeah, definitely. And in second year here, MSW counseling, second year only they are learning the method casework, because they will be able to practice in the field also. So first year they don't have casework. Second year, like you can just see in that courses, we talk about relevance of social casework and counseling.
Correct. So next we will discuss on second year the program details. MSW 12, that is an introduction of life characteristics and challenges, 4 credits. So this seems to be very interesting for me, because this is not just we are focusing some theoretical aspect. This particular course, introduction about life challenges or characteristics. So this not only teaching others, not only helping others, the students, the learners, they themselves can use these things in their life. That is very important aspect of this course.
Right from babyhood to adolescence, adulthood, old age. So all these aspects are covered.
So they can understand how they are born and what is their current developmental stages, their family stages. So everything they can understand. They can also observe probably their family milestones, so many things.
Yeah.
Another very important course under second year, that is MSW 13, Introduction to Psychology and counseling aspect. That is 4 credits.
Yeah. So here the course, like we have, like they are studying in depth, like about counseling, why, what, and how of counseling, various theories and models, and also like they learn about normal psychology and abnormal psychology. So various aspects related to personality, various theories. So all these are covered in these courses.
So in next course, students also can learn on relevance of social casework in counseling.
Yeah.
So many times we don't use this extensive method, but whereas here students can see the relevance of social casework in counseling field.
Yeah.
So another one is the basics of counseling, fields of counseling, social work practicum 2. So this is very important, where students can learn and all these things in their field work sector, as well as the internship is also very important. That internship carries 8 credits.
Yeah. So in the subsequent slides, we can talk about detail about the fieldwork components. Yeah.
So the entire this program has got 4 4 times the students have to do field work. That is one by one we will discuss.
So the university has prepared separate journals for all the 4 practicums. First, when we talk about MSW L46, so the learner should remember that L means it is practicum. So MSW L46, that is in the first year, we call it a social work practicum 1, and this is of 8 credits. Here what they are going to do, there is induction meeting. What is induction meeting? In the induction meeting is organized by the regional center or by the study center. So all the students who have taken admission either in the July session or in the January session, so they will be given like SMS, or they will be communicated when they have to attend this induction meeting. So in the induction meeting, the student will go and discuss with the concerned officials, or the regional director will be there, assistant directors will be there, and the fieldwork supervisors from social work professionals are there. So all these people will be there, and they will be orienting about the courses. What are the courses in social work? They will be giving orientation, brief overview of IGNOU as a distance learning university, how they have to go about, how they have to proceed with their theory exams, about their assignments, field work, so and so on. So they discuss everything in detail. So the students should not miss this induction meeting. This is very important. If they miss and they are lost, and finally they'll come towards the end of the first year, or they, after doing their fieldwork, they will come and they'll have a lot of chaos and confusion in their mind, and they don't know where to go, where to submit their journals, where to submit the assignments. So many problems, challenges arises if they don't attend this induction meeting. That is why we keep on saying our learners that they should attend this induction meeting at the beginning. After their enrollment, they have to contact the concerned regional center or the study center, so that they will be provided the right kind of information at the right time, so that they can plan to complete their course during that time. Then please go on to...
So next one is first year blacklistment in the same year. The blacklistment should be done in one organization or any one institution or any social welfare agency. So that means it is they have to, unlike field work, here they have to do it in one organization. So continuously for 1 month, the students under the supervision of a professionally qualified social worker, they have to do it. But primarily they have to learn all these things here. The learner are expected for a practical exclusiveness on any 1 or 2 of methods of group work or community organization or social administration or social action or social work research. So on any 1 or 2, they extensively they have to do it in this fieldwork blacklistment. So another very important fieldwork practicum is during second year.
MSW L48, that is in the second year. We call it a social work practicum 2, and it is of 8 credits. Again here, as I said, in 46 they will be attending the induction meeting. In the first year they will have 5 orientation visits, and here they have only 2 orientation visits. That is, orientation visits means they will be going and visiting different social welfare organization, institutions. So from that 5 organization, whatever they observe, so they will be writing a detailed report, whatever they have observed related to the agencies, like objectives, vision, mission, funding, and so many, their administrative structure. So many things we have given a pro forma, so the student will have to see the pro forma and fill the report accordingly. And all these details we have given in social work practicum 1 along with that journal. There is also social work practicum 1 and 2 in the first year, that is MSWL 46. In that they have to go through this, that is mandatory, and then they have to prepare the report and write the report in detail.
Ma'am, another the very important unique thing of our program is we have clear cut guidelines. We have clear cut a kind of schedule where the students have to follow thoroughly and practice it.
Yeah.
So that will be very easy for our learners, so that they need not to run here and there. They need not to search other things. So there is a clear cut kind of forma where students should follow step by step and discuss with their supervisor in their NGO or any organization, so they can learn that.
We have prepared a separate manual, that is social work practicum 1 and 2. One is the manual that it is a guideline for the students, so how to go about with the all methods. So we have given various models, examples, what is casework, what is group work, what is social welfare administration, what is social work research. So everything is clearly given with illustrations. So the student has to go through this. Then he has to start the field work, like as I said, 5 orientation visits in the first year, then 45 concurrent field visits. That is, they go to the organization. They can choose any organization, and they out of that 5 they can choose one organization and do their field work 45 days at a stretch. Or if they are working professionals, they can talk to the agency people. Correct. And they can manage like how many hours per day they can spend. So like that they will start the field work and do accordingly whatever the activities given by the organization, as well as practicing our social work skills and methods. They are need to put in their practice in the field. Then apart from this 45 field visits, they will be having 5 individual conference. That is, individual conferences. Personally, they go and talk to the supervisor. They discuss with the supervisor their personal problems or the problems in the agency. So everything is discussed with the fieldwork supervisor. This is how they do. And the second year, especially, we are focusing on this 45 concurrent field visits. We are asking them to do casework. So they have to select 5 cases. Maybe from the agency, they can refer to the trainee, that is the student. So they will just do their case, like study the case in detail and write the casework report. And what kind of intervention, how the learner is going to help the client. That is very important. So here the casework is very important in the second year. Then after this, they have internship in the second year, that is MSWL 49.
So there probably again intensively they'll be working in one organization. It could be any sector working in social field or health field or even NGO or any other government, non-governmental organization. So at a stretch they'll be able to, I think they'll have to work.
1 month. They'll go for first year also 1 month block placement they have. So 1 month they have to choose any organization or any institution. So they have to go 1 month continuously. They'll go to the field and work with their clients and work with the organization. So there are many activities carried out, like they go out, they have organized health camp, or they go to the community, they go to the open community, they work in the slums, or they work in the rural areas. Correct. Health awareness. So many things can be done. So it depends on the learner's interest also. Exactly. The learner, the student can choose based on his or her interest. Correct. Like the student wants to work with the children or the old age, or with mentally challenged people, or with the destitute. So many, like you Correct. Can see there are a lot of social issues where student can go and work. So they choose based on their interest.
So this particular fieldwork practicum, both in the first year and second year, not only giving them a kind of practical knowledge, but also they can see directly the clients, the people those who are suffering with various issues. They can work with individuals as well as their family members. Yes. So probably that theory and practicum will give them very good experience, so that in the future, if they are going for the job purpose, if they are going for higher education, or if they are working in any other sector, that will help them a lot.
Yeah, especially when you talk about counseling, MSW counseling, they should have that passion to work with people. They should have the commitment, dedication. Then only they can do this course. Otherwise, for the sake of completing a degree, IGNOU is distributing, that is not the thing. They have to be very sincere.
Exactly.
And definitely they will benefit out of this, and they will also in turn contribute to the society.
Exactly. Otherwise, just simply coming and going, that will not help them a lot. So the program requirements, the eligibility is graduation in any discipline from recognized university. So the students or learners can understand the eligibility is graduation in any discipline from any university, and medium of instruction is English and as well as Hindi, and duration is minimum 2 years and maximum 4 years. So program fees is Msw Counseling Program fees including registration fees, that is 100 rupees. Total 18,000 for each first year and second year. They will have to pay it. And now let's talk on assessment and evaluation.
Yeah, when we say theory courses, there is continuous assessment, that is tutor marked assignments. So they have to submit assignment for each courses. So before their term and examination, they have to submit their assignments, and then only they can go for their theory exam. And this again has weightage, 30% weightage is given for assignments, and the term and examination, 70% is the weightage given for the term and examination. And again, when we talk about social work practicum, this is one of the important component in social work program. For all our programs, either it is BSW or MSW or MSW counseling, we are giving more weightage to field work because we are following UGC norms, and so accordingly the weightage is given to social work practicum. Here it is 100% weightage, like the student has to get 50% from internal and 50% from external. So either like if he fails here or there, then he has to clear from both as well as internal and external.
So just not just getting admission, they'll have to do a lot of work here.
Yeah.
They'll have to go to field work agencies and internship, blacklistment, and top of that there is a clear cut assessment patterns.
Yeah.
So they'll have to clear all these assessments.
Otherwise it's like difficult for them, because many students, they come here like they have given all their theory exams towards the end of their maximum period.
Correct.
They come and they say that we have not submitted the journals. So this is what I'm saying from the beginning, like they have to plan it accordingly. Exactly. Once they start their enrollment, after they get proper communication from the regional center and study center, they have to start going to the field, start their field work, complete their field work for 45 days, and they have to write their reports. Usually always we are telling them that they have to keep a diary rough, note down everything, then they can fare it in their journals.
Correct.
So like that they have to follow
so very
this
systematically
procedure. They have
follow
to do it.
So now let's understand, madam. There are a lot of other, the specialities, the unique things, or even many times student may ask these questions. Why MSW counseling? Because there is a MSW, traditionally there is a Master of Social Work, program, and this is MSW, counseling. So why MSW? Are there any specific unique things or specific, objectives? So would like to ask you.
Because already we discussed when we say MSW counseling, this counseling services, they are very inadequate in India.
Yeah.
And there is also like growing demand for counselors. Like for example, many school counselors, they are required in all the schools. Like for example, if you see in Kerala, like all the government schools, they have school social workers. So this should not happen only in one state. So it should be like in all the states there. This has to be mandatory that all the government schools, not only government schools, private schools, they should have counselors, and the more preference should be given to social workers. Because again, there is always like overlapping of services like psychologists, social workers. So easily we have this course MSW counseling, so they have to learn the skills whatever required to practice in their profession. And counseling, easily we are focusing more on this in the second year, more focus. And if you see the courses, more weightage is given to that kind of courses where the student will be trained. And there are also specialized skill which are needed for our learners. So all that can be useful for our students by doing this course. Then we also want to develop a cadre of professionals to work in the field of counseling. So again, there is dearth of personnel who are insufficient in India, especially when we talk in India. And also there are only few universities they are offering this as a course. Maybe one or two you might have heard. When we launched this course in English from 2014, so that time we didn't have any universities who was offering this course as a specialization. So that is how we thought that this course will be very relevant for our learners who can practice this as their career, and they can work in different settings in different fields.
So another, as you rightly said, there is a traditionally there is a Master of Social Work, and this is a Master of Social Work in counseling. We predominantly focus on counseling skills, so that the learners from different background, they can learn specific counseling, and that counseling can be applied in different sectors like health sector, administration sector, women and women empowerment, or welfare organizations, or even industrial setting. So extensively they can learn the counseling skills here, and they can practice wherever they are working. So that is a very specific and a very unique thing of this particular program. The students, the learners can become full-fledged counselors.
So they can also go to different organization, different settings, like as you mentioned, like they can also work in family counseling centers.
Correct.
And work with couples, like healthcare settings, industry, as you said, educational setting, and other social welfare sectors. These are the broader areas. Like when you say in westernized context, like they specifically stick on to one setting. Like if they are a specialist in marital therapy, so they will be doing only in that. If they are family therapy, so they will be involved. But in India, it's more of generic, and we don't have any specialization as such. Maybe this course will definitely be beneficial to our learners when they enroll for this program.
And another the new developments in professional field concern, many government organizations or even non-government organizations, for any post of counselor, they specifically ask master degree in counseling.
Yes.
So whereas this particular program, the name itself says Master of Social Work in Counseling.
Yes.
So this certificate or this particular degree will help them to get jobs. As you rightly said, many schools are recruiting counselors. So probably our learners with this program, they can get into school fields where extensively they can work with the children and the family members.
Yes.
Another very important aspect what I would like to highlight here, the casework, as madam was saying, casework extensively they can practice as a counseling method here. So if they are working in education sector or even health sector, that social casework method extensively they can apply with children or with people with different issues, and they can bring out various positive changes.
Yes.
Probably that is a kind of unique thing where our learners can practice it.
MSW Council. Can you talk about the specialized skill set for these courses, listening, so observational skill, interviewing skill, then reflective practice, and so many other things like documentation. That is very important.
Correct.
Because when we say casework, they have to write case history in detail. They need to understand. So documentation is one thing which is missing in India also.
Exactly.
So this, I think it is mandatory, and all the students or learners who are taking up this program, they have to document everything.
And you were explaining all these particular techniques, madam. One thing, very important aspect you raised it, the listening technique. Many times, many learners, if they are practicing with their clients, it could be family related issues, it could be marital related issues, it could be children related issues, it could be their parenting related issues, or any other issues in the health sector. Many times, if you use this, listening skill very effectively, by listening, their entire, issues, the causing, problems, or their other supportive factors, probably that will give them a perfect picture on their problem. By listening their entire issues, sometimes they may also, the clients, the family members may also relieve, their stress, because that, particular step, it will take long duration. The therapist or the learner here, if they apply this particular skill with them, many times they may find a solution over a period of time. So like that recording you said, if they use this particular tool or particular technique very extensively, systematically and scientifically, over a period of time with 3 sessions or 4 sessions, they may find suitable solution. So that is, I think, these are all very unique, the skills or techniques of this particular program.
Yeah. So when we talk about, like, in social work, we are using many principles and values and ethics. These are very important that each and every social work professional should follow this. Now, how do you think, like, these are important to learners?
See, many, as you rightly said, our learners are professionally, they are. It is a professional course. The moment they get into this professional course, they will learn, these particular techniques. Unlike other programs, they will have to be very sincere. They will have to be very committed learners, and they will have to learn, this, techniques step by step. And scientifically, they should be able to assess a particular problem. Simply, they cannot say that I am just I am a professional social work trainee, and I can go to any sector, I can go to any area, I can talk to any client, I can find out their problem, I can provide a solution. So that will not happen like this. It is a systematic scientific process. They will have to learn systematically. They will have to sit with the client in a therapeutic environment, and there should not be any disturbances. There should not be any biases. There should not be any kind of prejudice. And scientifically, they have to apply all these techniques and record it and analyze it and find out a solution. And again here taking the help of the client and finalizing her own problem or his own problem, that's very important. So the therapist, the learner should not use his own ideas there. Probably he has to facilitate the client and bring out a solution from his own experiences or from his own the background. So that is, I think, a very unique system, I feel.
Yeah, when we talk about skills also, another thing reminds me that when you talk about casework, when you talk about therapy session, another important thing is termination and follow-up.
Yeah.
So this is also very important. So what do you think about that?
Correct. You are right. Many times we just leave the case just like that, but that is not going to help them. Since it is a professional intervention, termination and follow-up is both are very important components.
Yeah.
Because abruptly you cannot stop the case. It is a systematic intervention, right from establishing a rapport, right from assessing the problem, right from providing the solution or establishing the solution, right from implementation. So once the intervention is implemented, and once the patient or the client or the family members are able to resolve their issue on their own, so we should be able to provide them support at least little bit longer, and slowly we should be able to terminate the case. So we should provide some kind of support, some kind of help. And once you understand that they are able to resolve on their own, then you can terminate. And the follow-up is very important, because many times, for example, alcohol issues.
Yeah.
Many our learners will be working de-addiction centers. They'll be working in hospital. They'll be working with various alcohol clients. That learning this alcohol issue is a learned behavior, and that intervention, the support system should be there for longer period.
Yes.
Because anytime they may relapse. Anytime they go to community, anytime they may meet their old friends, they may encounter some kind of stressors, they may encounter some kind of bad incidents, so they may go back to their previous level. So here, not just providing intervention, when we have to stop, when we have to terminate the case, and how long we have to follow up this case, that is very important.
Yes.
So otherwise, this will be a kind of suddenly they may go back to the previous state and relapsed with the particular thing. So the trainees here, the learners here need to understand. You need to know when you have to terminate this particular intervention, when you have to for how long you have to follow up the case. So these two are very important aspect of any therapeutic setting.
That is why we are talking about the skill set. It's very important for our learners, those who are enrolling for MSW counseling program. These are the skills they have to develop during this period.
So now very important component is who can benefit from this program. healthcare providers and teachers. Here teachers means in a school, college, university. So any teacher can be benefited from this program. And NGO functionaries, religious leaders, service providers in terms of social and welfare agencies, and corporate sector. Another very important aspect is it's like a happening field. So corporate sector.
Yeah.
Many corporate sectors nowadays they are recruiting social workers, especially those who are having experience in counseling.
Yeah.
You may be knowing, madam. So nowadays, many corporate sectors are, they are, providing a wellness training.
Yes.
So wellness clinic and wellness training. Not just that they have to refer their clients to hospital. So they, in their corporate setting itself, they are having wellness clinic and wellness program. So probably
they are also organizing many stress for programs for stress management.
Right.
And for personality development. So many other programs are organized especially to keep them mentally fit.
Exactly. So this particular, I think this is a new scope for our learners. Probably once they are equipped with our therapeutic skills, they may be finding a very interesting jobs in corporate sector, including CSR. So not just some kind of helping the clients, some kind of providing a trainings, but providing a therapeutic intervention for the regular customers, regular the employees of particular organization. That is very important. So I think that is a highly demanding job nowadays.
Yeah. When you talk about religious leaders, how it is relevant?
See, many we have a lot of religious organizations working in a community. It could be Hindu-based organizations, it could be Christian-based organizations, or even it could be Muslim other organizations. They are extensively connected with the communities in their communities in the grassroots level. They are doing a lot of religious programs or community-based programs, lot of welfare activities. Probably our people. They can those who are involved in these religious activities, if they get trained in counseling, that may help in terms of providing professional intervention. And I would like to give an example here. When I was working in NIMAS before coming here, we used to have a tie-up with religious organizations. Okay. Because many people with psychological difficulties, psychological issues, the first they used to approach faith-based organizations or religious leaders. So that is there across the country. So we thought that not just ignoring their services, if we can have a good tie-up with these people, so they can refer these people to us, and if these religious leaders can get trained in counseling,
because they are the initial contact.
Exactly. So if they get trained in this counseling, at least minimum to moderate psychological issues can be resolved there itself.
Yes.
So along with their whatever they are doing religious practices, if they get trained in the counseling for their people, scientific mannerly, they can provide a counseling. They can resolve many psychological issues like anxiety, depression, or even minor OCD, some kind of stress adjustment related issues. So many can be resolved in their community itself. So probably that is a wonderful area where the religious leaders, religious people can be trained in our program.
They can play a vital role.
Exactly.
And then we also saw healthcare providers. By training healthcare providers, for example, ASHA worker. So for them also basic things like about mental health or stress management or related to health aspects. So do you think that they are overburdened? We are giving them training and so much is given to the lower level staff. So how they are able to provide this services, or they are able to reach to the community?
And very important, names you have raised, ASHA workers, healthcare workers. In fact, they are grassroots, level healthcare workers. They are having a wide knowledge and skills in the community. They can reach out to each and every unreached population. They are the peripheral health system in our country, and I was surprised to know their education qualification. Many people are having degree, many people are having master degree, many people are having intermediate background, and many people are having triple degree, master, double degree background. But if you can give them professional social work, counseling, skills, probably they are well equipped with our intervention. They can train various family members various clients in terms of their health resolving techniques, that will boost their morality, and they will also get a lot of opportunities. And many times they will be kind of mediators from family members to doctors or even nurses. So I feel initially they may feel overburdened, but if you can educate them the importance of this professional social work, the program, they'll be very happy to work in the community with the help of this particular program. I think they'll be able to identify the issues, analyze, and provide the service at the home, in their community itself.
Yes. So because many people, those who are living in remote villages, they are not able to come to cities or no multi-speciality hospitals. So at the initial stage itself, they are able to identify, and the first aid is given to these people. Okay, now we discussed about healthcare providers, religious leaders, then teachers. How do you say teachers are very important? They play an important role.
Many times, teachers, even whether they are in the government sector and non-government sector or aided sector, they are working extensively with the school children, college children, or even with the parents. So if they identify any kind of behavioral issues, they themselves can counseling them. So that is, I think, somewhere is missing in their profession. Probably, if teachers get enrolled with our programs, they can provide the psychological intervention or counseling intervention in their places itself. So I think that is also a wonderful area where they can get enrolled with our program.
Okay, Dr. Kannappa, we have discussed everything in detail. There are certain FAQs like frequently asked questions, how to get permission for field work. So it is got from the study center, the academic counselor or the fieldwork supervisor. They facilitate and they give the necessary permission. And already we discussed about how to go about with the fieldwork and who will supervise, the academic counselors or the fieldwork supervisors who got MSW or MA degree, they will be supervising. So, and again, we discussed they have to submit the fieldwork journals to the study center. So these are the frequently asked questions. I hope the learners of MSW Counseling Program, they have benefited from this session. We have discussed in detail about MSW counseling and the various fieldwork components and various other practical challenges and problems which can be handled at the regional center and study center level. Thank you, learners. Thank you so much for listening patiently.